If you're over 50, there's something sitting in your medicine cabinet right now that you probably think is helping you. But after years of seeing what happens inside the human body, I need to tell you that same medication might be quietly damaging the one organ you absolutely cannot replace. I'm Dr. Eris John, and what I'm about to share contradicts what you've been told, not because anyone was lying to you, but because the connection between common medications and heart damage happens slowly, invisibly, until it's often too late to reverse. By the end of this video, you'll know exactly which 5 everyday medications carry hidden cardiac risks that nobody talks about, why they're specifically dangerous after age 60, and what you can do starting today to protect yourself.
This isn't fear. This is clarity. Stay with me. Here's what troubles me most. These aren't exotic drugs. These aren't new experimental treatments. Many of them are things you've taken without a second thought. Some you buy without a prescription at the pharmacy. Some your doctor has prescribed for years. And because they've been around so long, because they seem safe, we've stopped asking the right questions about what they're actually doing to our bodies over time. I've spent 2 decades watching patients walk into difficult health situations, only to discover later that the medication they were taking to solve one problem was creating a different problem entirely, a problem with their heart. And here's what's critical. Most doctors don't see the connection because it happens gradually. It's not like a medication suddenly causes a heart attack the day you take it. It's accumulation. It's damage that builds silently until your heart simply can't compensate anymore. But, and this is important, if you understand the mechanism, if you know what to watch for and when to ask questions, you can protect yourself.
Let's start with the most common culprit, the medication found in nearly every American home: pain relievers. Specifically, the class called NSAIDs, non-steroidal anti-inflammatory drugs. You know them: ibuprofen, naproxen, diclofenac. You take them for a headache, you take them for back pain, you take them for arthritis, and they work. Nobody's denying that. They actually reduce inflammation and provide relief. But here's what most people don't realize. Taking these regularly after age 60, especially if you have any cardiovascular concerns whatsoever, puts your heart under a specific kind of stress that younger bodies can usually handle, but older ones often cannot. And I'm about to explain exactly why, because the mechanism matters. When NSAIDs block inflammation, they do something else simultaneously. They interfere with substances in your kidneys and blood vessels that normally protect them. This creates 2 cascading effects, and the second one is the real danger. First effect: fluid retention. Your kidneys start holding on to salt and water. Picture your heart as a pump. Now imagine suddenly there's significantly more fluid in the system that pump has to move. A young, elastic heart can handle that increased workload. It adapts. But a heart that's already stiffened with age, a heart already working against high blood pressure, that heart starts to struggle. Over weeks or months of regular NSAID use, that accumulated stress can lead to what we call heart failure. Not a heart attack, heart failure, meaning the organ simply can't pump efficiently anymore. Second effect: blood vessel constriction and rising pressure. These medications can narrow your blood vessels. That means your heart has to pump harder against greater resistance. Think of it like forcing water through a narrower hose. The pressure increases. Now here's the part that surprises most people. If you're already taking blood pressure medication, certain NSAIDs can actually cancel out that medication's effect entirely. Your pressure rises without you realizing it. Your doctor checks your blood pressure at your next visit. It looks fine because you took it on a day you weren't using the NSAID. But most days, your protection is gone. Let me give you a real scenario. A patient, let's call him Robert, was 71 years old. He'd had his knees replaced years earlier and dealt with chronic knee pain. He took ibuprofen almost every single day. One afternoon, while walking, he felt exhausted. His ankles began swelling. By evening, he couldn't catch his breath lying down. The emergency room diagnosis: acute heart failure. Now, Robert didn't have a weak heart from disease. His heart was being overloaded by chronic fluid retention from medication. The damage accumulated so slowly he never saw it coming. And here's what matters for you. The risk depends on dose and duration. High-dose ibuprofen, 2,400 milligrams daily, is far more dangerous than occasional use. Diclofenac is particularly risky. Naproxen appears slightly safer, but the danger is never zero. And if you're taking low-dose aspirin to protect your heart, certain NSAIDs like ibuprofen can neutralize that protection completely. The solution isn't suffering through pain. It's being honest with your doctor. Ask directly, given my age and my heart health, what's the safest option for my specific pain? Sometimes acetaminophen works fine. Sometimes topical creams applied directly to the painful area are enough. And if NSAIDs are truly necessary, the rule is lowest dose, shortest duration possible. This next medication might surprise you because it's prescribed specifically to protect your health. Proton pump inhibitors, or PPIs, medications like omeprazole, pantoprazole, lansoprazole. They're among the most prescribed drugs in the entire world. Millions of people take them every single morning, often for years, sometimes for decades. They're prescribed for acid reflux. They're prescribed to protect the stomach if you're taking those NSAIDs we just discussed. They seem harmless. They seem beneficial. And here's the bitter irony I see repeatedly. The medication prescribed to protect you from one problem might be creating a completely different danger. And the way it damages your heart is subtle enough that most doctors miss it entirely. Let me tell you about Susan. She was 67. She'd struggled with acid reflux for years, and her doctor prescribed omeprazole. The reflux disappeared. Problem solved, she thought. She took it reliably every morning for 8 years. Then, one day, during a routine checkup, her EKG showed something unusual. Blood work revealed the cause. Her magnesium levels had dropped dangerously low. Now, magnesium isn't just some random mineral. Magnesium is essential for your heart's electrical system. It's what keeps your heartbeat steady and organized. When magnesium depletes, your heart becomes electrically unstable. Irregular rhythms emerge. Dangerous arrhythmias can develop. Why did her magnesium drop? Because PPIs reduce stomach acid, and stomach acid is absolutely essential for absorbing magnesium from food. Suppress the acid long-term and magnesium absorption collapses. But that's not even the most concerning part. Multiple large studies have found an association between long-term PPI use and increased heart attack risk. The theory is still debated, but the leading hypothesis involves something called nitric oxide, a molecule that keeps your blood vessels flexible and dilated. PPIs may reduce nitric oxide. When that molecule is depleted, blood vessels become rigid. Rigid vessels set the stage for plaque buildup. Rigid vessels are where heart attacks begin. Additionally, PPIs can interfere with antiplatelet medications like clopidogrel, drugs given after heart attacks to prevent future ones. They can make that protective medication less effective, leaving the patient vulnerable. Here's what bothers me. These drugs were designed for short-term use, 4 to 8 weeks, but they've become a permanent fixture in millions of medicine cabinets, taken year after year, sometimes indefinitely, for problems that could often be managed through dietary changes or other approaches. If you've been taking a PPI for months or years, don't stop suddenly. That can cause rebound acid problems. But do have a conversation with your doctor. Ask, do I genuinely need this long term, or can we try reducing it? Are there alternatives? And if I must continue, can we monitor my magnesium levels periodically? This next medication might surprise you because it's something you probably grab without thinking, and it can have immediate, serious effects on your heart. You catch a cold, your sinuses are completely blocked, you can't breathe. You reach for a cold remedy containing pseudoephedrine or phenylephrine. It works immediately. Your nasal passages open, you can breathe again. Relief. But that relief comes with a hidden price that becomes far more dangerous after age 60. These decongestants are vasoconstrictors. That means their job is to narrow blood vessels. In your nasal passages, that's exactly what you want. The narrowed blood vessels reduce the swelling that's blocking your breathing. But, and this is critical, the drug doesn't stay in your nose. It travels throughout your entire body, constricting blood vessels everywhere.
This creates two serious consequences. First, your blood pressure spikes. By narrowing arteries throughout your body, your heart has to pump against much greater resistance. It's exactly like trying to force water through a squeezed hose. The pressure increases dramatically. For someone over 60 with existing high blood pressure or cardiovascular disease, this spike can be severe. It can trigger heart palpitations. It can cause chest pain. It can precipitate a dangerous cardiac event. Second, there's stimulants. These drugs stimulate your nervous system, making your heart beat faster and sometimes irregularly. If you already have a sensitive heart, this extra stimulation can destabilize the entire electrical system. Let me give you a real example. A woman, Margaret, was 74 years old. She caught a severe winter cold. To breathe, she bought a well-known cold remedy with pseudoephedrine. By the second day, she felt like her heart was racing and pounding. She had severe dizziness and a splitting headache. Her son drove her to the emergency room. Her blood pressure was dangerously elevated. Her heart was in an irregular rhythm, an arrhythmia. The cause was clear once we connected it. The decongestant had pushed her cardiovascular system into a crisis. Recently, medical agencies in Europe have been refocusing attention on pseudoephedrine specifically because of its link to rare but serious conditions involving blood vessel constriction in the brain. When a simple cold remedy carries that kind of warning, it tells you how powerful this drug is throughout the entire body. The danger is magnified because these drugs are available without a prescription. People buy them without reading warnings. They don't think about risks. They just want to breathe. If you're over 60, and especially if you have high blood pressure or any heart condition, avoid these decongestants completely. There are safer alternatives: saline nasal sprays, humidifiers for your room, nasal sprays containing corticosteroids that work only locally. Don't solve one problem, nasal congestion, by creating another, a heart crisis. This next medication is delicate because it addresses something deeply important: mental health. Depression is serious. It's a risk factor for heart disease itself, so treating depression is genuinely crucial. The issue is not that we should avoid treating it. The issue is how we treat it, specifically with which medications.
I'm talking about an older class of antidepressants still used today, tricyclic antidepressants. Names like amitriptyline, imipramine, nortriptyline. They were developed decades ago, and they do work for depression. But they also work for chronic pain, nerve pain, arthritis pain, and that's where they're often used in older adults. And for an aging heart, they carry specific risks. These drugs can trigger a sudden drop in blood pressure when you stand, what we call orthostatic hypotension. You're sitting down, blood pressure's fine. You stand up, and suddenly your pressure plummets. The world spins. You lose balance. You fall. For someone over 70, a fall often means a fracture. A fracture often means surgery and rehab. And sometimes it means the beginning of a loss of independence. But there's more. Tricyclic antidepressants can also increase your resting heart rate, meaning your heart is constantly working faster under more constant stress. For a heart that's already aging, that's significant accumulated strain. And the most concerning effect, these drugs can interfere with your heart's electrical system. They can slow down the impulses that keep your heartbeat organized and regular. This shows up on EKGs as specific electrical changes, and it increases the risk of dangerous arrhythmias, sometimes life-threatening ones. Let me share a specific situation. A man named David was 76. He had diabetic nerve pain in his feet, real pain that affected his quality of life. His doctor prescribed amitriptyline, an older antidepressant, at a moderate dose. Within weeks, David started feeling dizzy every time he stood. One day, he got up from his chair too quickly and fainted, fracturing his hip badly. The medication had triggered orthostatic hypotension. Now, here's what's important. Tricyclic antidepressants are rarely the first choice for depression in older adults anymore. Modern antidepressants are safer for the heart, but these older drugs are still prescribed for pain management. If you or someone you love takes one of these, it's essential to ask your doctor, have we tried safer alternatives? Is my blood pressure being monitored? Is my heart rhythm being checked regularly? Mental health and heart health must be managed together. This final medication isn't something your doctor prescribes. It's something millions of people take on their own.
thinking they're investing in their health, in their bones, in their future strength. I'm talking about calcium supplements. The message has been drilled into us for decades. Take calcium for strong bones. Protect yourself from osteoporosis. This is especially directed at women. This is especially directed at older adults. But in recent years, something troubling has emerged in the research. And I want to be clear, the evidence isn't settled. The debate is real. But the concern that exists in the medical and research community is significant enough that you need to understand it. A woman named Patricia was 69. She wasn't waiting for a bone density test or a prescription. She was worried about osteoporosis, so she started taking high-dose calcium supplements on her own every day. She felt proactive, responsible. Years later, she suffered a heart attack. She had none of the classic risk factors. She didn't smoke, her cholesterol was good, her blood pressure was controlled. Her doctors were puzzled initially, but investigating possible causes, they kept coming back to one thing: those calcium supplements she'd been taking for years. Here's the theory, and it's based on how our bodies actually process calcium. Calcium from food sources, from dairy, from vegetables, from natural sources, is absorbed slowly by your body. Your intestines process it gradually. Your body uses what it needs, and the rest is excreted. But when you take a concentrated supplement, you create an artificial spike of calcium in your bloodstream. Your body can't use all of that calcium for your bones, and excess calcium has to go somewhere. The primary concern is that it deposits in your artery walls. When calcium builds up in arterial walls, it's called arterial calcification. It makes arteries rigid and brittle. Rigid arteries are where plaques form. Rigid arteries are where heart attacks begin. Some large studies suggest calcium supplements modestly increase heart attack risk. Other studies haven't found this connection. The evidence is complex and, frankly, debated. For people with diagnosed osteoporosis, the benefits of preventing a fracture might outweigh the cardiovascular risks. That's a conversation between you and your doctor. But the lesson is clear: more is not always better. We've uncovered 5 common medications or supplements that carry hidden cardiac risks most people never discuss: pain relievers, stomach protectors, decongestants, certain antidepressants, calcium supplements. Let me be absolutely clear about something. My message is not stop taking your medications. Stopping medications without medical guidance would be dangerous. If you're on any of these, you shouldn't make changes alone. My message is empowerment. Now you understand the mechanisms. Now you know what to watch for. Now you have the language to ask the right questions. The next time you see your doctor, come prepared. Bring a list of everything you're taking: medications, supplements, vitamins, over-the-counter remedies, every single thing. Ask directly: I've learned that this medication can potentially affect the heart. Is it still the right choice for me? Are there safer alternatives? Should we be monitoring something like blood pressure or magnesium levels or heart rhythm? Every medication is a trade-off between benefits and risks, and that balance changes with age. Your heart has worked for decades. It deserves precision care, not assumptions. The most important conversation you can have is with your doctor. But before that conversation, you need information. And now you have it. If something here surprised you, share it. Drop a comment. Tell me which of these medications caught your attention. Your comment doesn't just help YouTube understand what matters to this audience, it might prompt a friend or family member to have an important conversation with their own doctor. And please subscribe to this channel. My mission is to bring you health information grounded in actual research, explained in language that makes sense, presented with respect for your intelligence. In my next video, I'm going to reveal something equally important: 3 habits most people do daily that seem harmless, but are quietly accelerating aging in ways researchers didn't fully understand until recently. And I'll show you how to modify them without extreme sacrifice. You've invested 15 minutes in understanding your heart's hidden vulnerabilities. Invest another 15 minutes to learn how to actively protect it. I'll see you there. Take care of yourself. And take care of your heart. You deserve both.